Good afternoon and welcome to Fred Conley, legislative candidate from District 11. Thank you, Fred, for joining us today for our virtual legislative candidate meetings. I know you're joining us via phone today, so we do appreciate you taking the time to dial in. My name is Gina Ragland, and with us today are lead AARP advocacy volunteers Susan DeCamp and Bob Lassen, and Emily Wick is also joining us from the AARP state office. We appreciate your taking the time to meet and discuss issues of importance to the 50-plus voter and their families in Nebraska. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. Fred, if you want to start us off by giving us a little background about yourself and your campaign, again in a 5-minute or less would be great. Once we have completed your opening, we'll move into the questions. So go ahead, Fred.
Oh, okay, this is Fred Conley. I'm 72 years old. I think I'm a member also of AARP. I went to high school in Omaha, graduated from North High School, then went into the military. I served in the United States Air Force for 3.5 years, came back and finished college at UNO under the Bootstrappers program, went to graduate school with about 20 hours in psych and social, and then went to Creighton Law School and graduated in 1980. I've been married to my wife for 52 years, and I had 3 kids. One passed away June 6th from cancer, and so now I have 2, a boy and a girl, at home. So I look forward to responding to your questions. Thank you.
Great, thank you, Fred. And just to note, we also have now Mike Barwig is another AARP volunteer that has joined us also. So if you hear Mike asking you some questions, you'll know that he's on the line as well. We'll move now into the questions, and we have provided you with a set of 3 questions pertaining to the 50-plus in Nebraska. Again, we're looking at allotting 5 minutes or less for each of those questions. And so to begin with question 1, helping people stay in their homes and communities, Mike is actually going to answer or ask you that question. So go ahead, Mike.
Good afternoon. A livable community is one that is safe and secure, has housing that is affordable in that no more than 30% of the income is spent on housing, transportation options that allow individuals to travel by multiple means, and supportive community features and services for people of all ages, allowing people to remain in their communities as they age. What steps will you take to ensure all Nebraskans have access to livable communities?
I feel very passionate about this issue. Affordable housing is one of my top legislative priorities. Everyone deserves the comfort and dignity of a home. Additionally, many people want to age in their homes. Making sure home health services are accessible and affordable is key to making sure it's a possibility for all Nebraskans.
Great, thank you, Fred. Do you have any additional comments you want to add to that, Fred?
No, I think I said being of age, I'm very passionate about this issue. Excellent. And we'll work with other organizations to make it a reality.
Great, thank you.
Fred, I've got a quick question. Transportation, I'm not sure. I know that even in the Omaha area, we have problems with some transportation. Is there any idea that you have that would be something that we could use to get better transportation for people in not only the large city, but the rural areas?
Well, I guess not knowing all of the answers, I would be looking to organizations that work in the area in terms of some suggestions that might be approved or implemented at the local level with the state's involvement.
Great. Thank you, Fred. Our second question today is on health, caregiving, and home and community-based care, and it comes from Susan DeCamp, again, one of our AARP volunteers. So go ahead, Susan.
Good afternoon, Fred. Nice to have you with us. Caregivers help older persons live independently at home by providing assistance with activities such as dressing and bathing and performing medical and nursing tasks such as administering medication. Caregivers often provide these services with little or no training and oftentimes with little or no pay. So with that in mind, I have a two-part question for you. First, if elected, would you support helping caregivers with things such as paid leave, respite services, telehealth, and access to education and training? And secondly, how would you protect or expand paid services and supports, as well as financial security that allows more seniors to live independently in their own homes?
Okay. First part of the question, absolutely. I support. Paid leave is essential for all workers, especially those who care for our most vulnerable populations. I will support expanding telehealth services, implementing the expansion of Medicaid, and expanding food security, if elected.
Great, thank you very much, Fred. By food security, I'm assuming you mean the SNAP program?
Yes.
Okay, thank you.
Great. Thank you, Fred. Our last question then comes from Bob Lassen, and it's to address nursing facility quality. So Bob, go ahead.
Yes, thank you for being with us today, Fred. In Nebraska, an estimated 6,600 Nebraskans reside in one of the Nebraska's 211 nursing homes. By 2040, the University of Nebraska Omaha projects that number will more than double to almost 14,000 people. Due to a variety of factors over the past few years, Nebraska has seen an increase in nursing facilities having to close and residents having to move or relocate elsewhere. How will you ensure that Nebraska residents receive quality nursing home care, including ensuring an adequate nursing force, education, training, and proper reimbursement?
I will work with the relevant organizations to make aging with dignity a reality for all Nebraskans. First, access to home health care services is crucial, especially during uncertain times. Second, making sure that we attract a workforce that can fill these positions is also very important. I will work to expand technical schools opportunities across the state. Third, implementing the expansion of Medicaid and making sure seniors have access to health care will be a top priority.
Great. Thank you,
Thank
Fred.
you.
I appreciate your taking the opportunity to answer those three questions. And I do want to open it back up to our panelists around the table and see if anyone else has any additional questions they'd like to ask Fred at this time.
Sure.
Fred, this is Susan again. I was just wondering regarding financial security, one piece to that would be maybe the drug prices that we're having to pay. For example, last year there was some proposed legislation that would cap the cost of insulin. I just wondered if you have any ideas or thoughts on what maybe we could do to help the drug prices and helping keep the out-of-pocket expenses down for seniors.
Well, I know that's an issue not just in Nebraska, but across this country. And I would certainly be open to suggestions from those who are involved in this on a day-to-day with seniors in terms of what can be done from a state perspective to lower the cost of prescription drugs.
Okay, thank you.
Great. Any other questions anyone has for Fred? Okay. Thank you, Fred. As we come to the end of our meeting, I would like to offer you the final minutes to offer any closing thoughts or comments that you might have, or what messages you'd like to send to the constituents in your district. So go ahead, Fred.
Well, okay. When I started out, I didn't mention the 4-point program that at least I'm starting off with in terms of running for this position. One of them was protecting voter rights. Secondly, support of public education. Third, 2-year tuition-free for high school graduates who are enrolled in community colleges. And 4, affordable housing and economic development are the 4 points that I'm running on for this position. I just want to thank people from AARP for giving me the opportunity to talk about the 3 issues I think that are important to most seniors throughout the state. And I look forward to working with not only AARP, but other organizations that are involved in the same endeavor. Thank you very much for the opportunity.
Right.
Bye.
Thank you again for
Thanks,
taking
Fred.
time to visit with us, Fred. We wish you the best with your campaign. And again, thank you for meeting with AARP today. Have a great day.
Oh, you're
Fred.
welcome. You're welcome.